I see a knee that comes in with a trauma, I think with an effusion after a trauma, I think cruciate injury, either posterior or anterior. I think osteochondral lesion or fracture. I think possible meniscal tear. I think patellar dislocation or subluxation, and I think possible tibial plateau injury. That's a trauma without any specific mechanism. Just comes in with a big bloody effusion. Those are all serious pathologies. Cruciates, osteochondral lesions of some type, meaning cartilage or bone in the joint, meniscal tear, patellar subluxation or dislocation, because that can cause an effusion, or tibial plateau fracture. Now, there's probably other things, but those things I have to think those are serious, and that needs to be ruled out. Okay? But if they do have an effusion, do you remember where most in extension, in full extension, the posterior capsule is going to push fluid anteriorly, right? And so it's going to show up in this position. Now, if they have an effusion, are they going to be able to get into full extension probably? No. Why? Because where can the knee accommodate the most fluid? In slight flexion. So they're probably going to have an extension leg to begin with. All right? And if they're uncomfortable here, do what Paul did and just give them a little support, okay, so they're comfortable. But what you can do you remember the patellar effusion test? You take the web space and you squeeze down on the suprapatellar pouch, and then you come down below the patella, and you can do a fluctuation test. If there's fluid, you can actually move it out of the suprapatellar pouch through the joint. Remember this? This is one of the fluctuation type tests for effusion. Okay? All right, that's one. The other one is a ballotable or a floating patella, that if there's fluid in the joint, it's going to push the patella up, and it'll float on that fluid. And what you can do is a patellar tap. You actually feel the patella, it'll click or pop because the fluid's pushing it up. You tap on it, it'll go tap, tap, tap. So the patella will move down and displace that fluid. When you let up, it'll push back up. Okay, that's a patellar tap test or patellar ballotment, ballotable patella. Do you remember that term? B-A-L-L-O-T-A-B-L-E. I think it's in your text. 798, thank you. So those are two tests for effusion. All right? And then, do you remember just the review from last year? Do you remember one of the best ways you can look at subtle extensor lag loss? How? No, well, they won't. Yeah, if they have you never want them to do a straight leg raise if they can't do a straight leg raise with an extensor leg, so they can't do that. But remember lying in prone and looking at heel height difference? Lie prone. Slide all the way off the edge of the table where your knees are off the edge. You all right, old man? You had a hard day, man. I thank you for all your efforts. But with the knee off the edge of the table, just looking inferiorly, remember, heel height difference might be a good way to show subtle differences in knee extension. You might not be able to assess it supine with the standard goniometry method, but what you look at is a heel height difference, that one heel won't be down as far as the other. Do you remember us talking about that in 560s? Anybody remember prone heel height difference? So if you do, raise your hand. Good, you guys were paying attention. This is very important clinically. I think you might be able to pick up subtle extensor legs here that you won't see supine. Okay? And I'll bet those of you that had knee surgery of some type, if you did this, you probably have a difference. All right, man. Those are the patellar